Hello, my name is Michael Monte. I'm a respiratory care student at Miami-Dade College Medical Campus. Today I'm going to do a demonstration on positive airway pressure utilizing a product called EzPAP. Essentially what we'll be doing is providing bronchial hygiene therapy using lung expansion and positive airway pressure. The indications for positive airway pressure are to reduce air trapping with asthma and COPD, to help mobilize retained secretions in patients with cystic fibrosis and chronic bronchitis, to prevent or reverse atelectasis, and to optimize the delivery of bronchodilators in patients receiving bronchial hygiene therapy. Contraindications for this type of treatment are patients that are unable to tolerate the increase in work of breathing, patients with intracranial pressures greater than 20 millimeters of mercury, hemodynamic instability, recent facial, oral, or skull surgeries, esophageal surgeries, epistasis, active hemoptysis, and acute sinusitis. The potential hazards or complications that may be encountered are increased work of breathing, leading to hypoventilation and hypercardia, increased intracranial pressure, cardiovascular pressures, cardiovascular compromise, pulmonary barotrauma, claustrophobia, nausea, and air swallowing that leads to vomiting and aspiration. Now, I'll check the doctor's order, and I see we're calling for the use of EzPAP because of atelectasis in the lower lobes. I'm going to collect my equipment, and then I'm going to head into the room to introduce myself to the patient and perform the therapy.
Hello.
Hello. Hi. How are you? Mr. Caballo. My name is Michael Monte. I'm a respiratory care student. Your physician has ordered bronchial hygiene therapy for you today.
Okay.
It's a form of positive airway pressure treatment, and I'm going to administer that once I've taken care of washing my hands and stuff. Do you understand what we're going to do today?
Yes, sir.
Very good. I'll proceed to wash my hands for at least 15 minutes with warm water and soap. Excuse me, 15 seconds. I'll then don my proper PPE. In this instance, we're going to be using gloves today. Mr. Caballo, essentially, I'd like to explain in terms you'll more easily understand. Positive airway pressure will open your lungs more, and it'll help you to bring up secretions that you've been having trouble bringing up on your own. Okay?
Thank you.
Very good. Real quick, I'm going to check your birth date and your medical ID number from your chart along with your name and verify them against your medical ID bracelet. I'm checking the name and the medical ID number, and they both match. Very good. I would then proceed to move you into an upright position to do this therapy, but of course you're already in an upright position. So now I'm going to assemble my equipment. But real quick, I want to verify that you still have crackles in your lower lobes. So I'm going to do vital assessments, but that's just being verbalized today to expedite the demonstration. I'll be checking your breathing. Please breathe in deeply for me. Again. Again. And yes, indeed, I hear atelectasis in the lower lobes. So again, we'll begin our treatment. I'm going to attach an EzPAP device to a 7-foot length of tubing. The EzPAP, in this instance, has a manometer on it. What I've done is I've set our goal of 20 centimeters of water pressure. That's what he'll be aiming at once we've put the thing together, started our treatment. Okay. I'm careful not to touch the front of the mouthpiece. Keep it sterile. We're going to put a nose clip on you. Let me explain what we're going to do first. Okay. First, I'm going to have you take a deep breath in Not a maximum size breath, but a deep breath. I want you to exhale and be calm, because essentially what we're going to do is we're going to breathe in and out of this 10 to 20 times.
Okay.
Then I'm going to ask you to huff cough. I'm going to
Okay.
ask you to cough like that 2 or 3 times.
Okay.
And then we're going to repeat the process another 4 to 8 times over the next 10 to 20 minutes, depending upon, you know, how well you deal with the therapy. All right? Okay. First, I'm going to put a nose clip on you. It'll be a little uncomfortable, but it won't kill you. And essentially that's to make sure that we get a nice tight seal. We're only going to be breathing from our mouth and not our nose. And quickly, let me turn the oxygen on. We're going to set that to 5 liters. Now again, breathe in and out. Very good. You're attaining your goal of 20 centimeters of water pressure. Very nice. Not too hard, just nice even breaths. I don't want you to overexert yourself. Perfect. You're doing great. Now, if you don't mind, what we'll do is I'll ask you to huff cough a couple times. Sit up. Very good. Essentially what that'll be doing is that's going to bring up the secretions that he's been having a hard time bringing up. What we'll do then is we'll take sputum samples and we're going to study the quantity, the viscosity, the color, and the odor of the sputum. At this time, I want to reassess your vitals. I'm going to do that, and I'm verbalizing that, but I want to listen again to the breath sounds. That's what I'm mostly concerned with. Very good. I hear almost no crackles. That's a sign that the therapy's been very effective. Okay, Mr. Cavallo, are you comfortable? Is there anything else I might be able to do for you?
Yes.
Okay. At that point, I'm going to take my gloves off. I'm going to do hand hygiene. I'll wash them again for at least another 15 seconds. Then I'll say goodbye to my patient, and I'll go out into my office and I'll note my findings in the patient's chart. I hope this presentation's been helpful. Thank you. My name's Mike Monte.